Most people who have migraines will have a history of a first-degree relative or relatives that suffer from migraines. Some patients I have only get their migraines around the time of their period. Those that started getting migraines from a young age or no trauma or genetic, they are more likely to be the ones that the migraines just kind of go away on their own.
Hi, everyone. Welcome back to Fem Health. We are talking to Dr. Kimberly Johnson Hatchett today. She is a board-certified neurologist, and today we're talking all about migraines. So, Dr. Hatchett, let's get into it. Why do migraines happen?
So that's a really good question. Migraines are, let's just talk specifically. When people say migraines, they're a specific type of headache. And why they happen is changes in blood flow in the brain. And some people are more susceptible to migraines than others. Some people have had headaches all their life and didn't realize they were having migraines until they really understand what migraines are and then the actual the symptomology of it. So like the actual symptoms that cause migraines. Like I'll say this, I suffered from migraines for years, and until I went to medical school, didn't realize I was having migraines. So why they happen, they can be hereditary. Most people who have migraines will have a history of a first-degree relative or relatives that suffer from migraines. And again, it's a change in the flow and also a change in neurotransmitters in the brain, specifically like serotonin.
And so how come some people get them and some people don't?
So some people get them because they have more of a susceptibility, like a genetic precursor or a genetic predisposition to getting them. But they also may have head trauma, can increase your risk of getting migraines. So, and when I say head trauma, I'm not meaning like crazy head trauma, but like say if you're in contact sport, like soccer, have had concussions in the past, you have an increased risk of getting migraines. If you are a woman and have changes in your hormone levels, increased risk of migraines. Some patients I have only get their migraines around the time of their period. There's actually medications that are specific for patients who have migraines around their period, and they take them before their period starts, during their period, and after their period, and to prevent them from getting their migraines. So those changes in hormones, head trauma, and then just genetic predisposition to getting them.
And is migraine something that you can outgrow? Because from personal experience, I actually used to get the worst migraines when I was a teenager. And to the point, had to go into a room, turn the lights off, felt extremely nauseous. And then it just kind of subsided with time. And I couldn't even tell you why.
Yeah, so that is very true. So I would say I'm not at that stage yet. I still get them every once in a while. But my father used to get migraines awful. And then he said in his mid-40s, they just kind of went away. So yes, migraines can last your lifetime, or they can just be something that after a few years, changes in hormones, changes in your body, changes in blood flow, just changes in general in your actual body, that could cause your migraines to just kind of subside and go away.
And is there anything that evidence has shown that makes someone more likely to have their migraines go away with time, or not really?
Not really. And I think even that we're hypothesizing or given the hypothesis that this is why people have migraines, but like the serotonin levels, neurotransmitters, all those things. But really, if you look at the evidence, they really don't know. They're giving these hypotheses as to why people get them and how they start and when they end. I think some people who are having migraines from head trauma, absolutely, it's that trauma's there. That area of their brain is irritated, and so they're more likely to have migraines for the duration, for the rest of their life. But those that started getting migraines from a young age or no trauma or genetic, they are more likely to be the ones that the migraines just kind of go away on their own.
Is there a gender predilection for migraines?
Yeah, unfortunately, yes. Women are more likely to get migraines, and that's mainly because of the hormone changes that we have. But yes, women are more likely to get migraines than men.
And does it actually correlate with any parts of our lives in terms of like, would a migraine risk go up during, well, you said periods, but what about pregnancy or menopause?
So what's interesting about that is that A lot of people will say that their migraines decrease during pregnancy. And another disease process like multiple sclerosis. People, when they get pregnant, they sometimes come off of their medications for multiple sclerosis because it gets better during pregnancy. I was not the lucky one. When I was pregnant with my first kid, I actually increased my number of migraines. And then you can't take ibuprofen during pregnancy. So that sucked. But yeah, so it just depends. But some people will say that during pregnancy, their migraines get better.
You know what's interesting is there's also this thing that I'm sure you've heard of it. People call it a pregnancy headache. What is that?
So it could be a lot of things. I've had patients who have dehydration. They're dehydrated so they're getting these Braxton Hicks contractions, but they're also getting these headaches, and it's just because of dehydration. You're also having wild changes in blood flow. So they're getting what they are deeming these really horrible headaches. And you take it very seriously because it could be signs of blood pressure changes. It could be signs of preeclampsia and those things. So when a pregnant patient starts having headaches, like the headaches start while they're pregnant, you want to do a full gambit of a workup to make sure that you're not missing something that's, big and bad. And it's not just a pregnancy headache.
And Dr. Hatchett, where can people find you on social media if they want to learn more about you?
Sure. So I am on Instagram. I'm under Dr. Kim Neurodoc. You can also find me on my website, drkimberlyjhatchett.com. And I have a newsletter called The Bluff. It stands for the bottom line up front. And there's links on Instagram and on my website to sign up for the newsletter.